Hello, I'm Katie, the Beauty Editorial Director at Harrods, and I'm here with Dr. Alexis Granite, the Consultant Dermatologist for Kiehl's. And today we're going to be busting some fake news that surrounds corrective skincare. So first, let's start by talking about salicylic acid, which I feel most people associate with acne-prone skin. Is that true? Can it be used elsewhere?
Yeah, so salicylic acid is a beta-hydroxy acid, so that means it's an exfoliant essentially. And it is great for acne, so it's anti-inflammatory as well, antibacterial, it helps unclog pores, but actually has a whole host of other benefits for the skin.
Like what?
So it's a keratolytic.
That is a big word. What does that mean?
Yes, we like that word in dermatology. That basically means that it makes skin cells less sticky and more able to shed. So boosts skin radiance and brightness. It also helps fade pigmentation over time. It's a collagen stimulator.
So it's really a multitasker.
It really is, yeah.
That's so interesting.
Yeah.
So are all dark spots linked to sun exposure, or do they have other, I mean, I know you mentioned hormonal skin, for example.
Yes, exactly. Yes, so a lot of dark marks are sun-related, so freckles, sunspots. But there are a whole host of other sorts of pigmentation that you can have that may not be sun-related. So one example is moles. Moles obviously do have some relation to sun, but there's much of it is also genetically determined, so you can get moles all over the body in places that have never had any sort of ultraviolet exposure. Same thing with lentiginous, so that's a derm term. So lentiginous basically look like dark freckles, and they can similarly to moles, they're flat, exactly, and those can also be found all over the body, even inside the mouth, in the eye, on the lips. Freckles, on the other hand, are just increases of pigment in the skin, so melanin in the skin, and those tend to lighten or darken depending on the time of year, and those can be affected by skincare.
We are talking about using skincare for aesthetic reasons, right? There is no actual harm to having freckles on your face or having a bit of pigmentation. There's nothing actually wrong with that.
No, absolutely not.
Well, at the moment, skincare is definitely the new makeup, isn't it? It's all about having this bright, glowy skin and not having to, like, letting that be your foundation.
Exactly.
Yeah. Let's talk about pigmentation, because people always assume that pigmentation means darker skin patches, right? But that's not always the case.
That's right. So darker pigmentation is known as hyperpigmentation, but you can also have hypopigmentation, which means too little pigment. You can think of this as sort of like the inverse of freckles, so little tiny light spots of hypopigmentation that can be seen on the face, but more commonly are seen on the arms and legs.
All of the same ingredients in the corrective ranges will help hypo as much as hyper, or is it different ingredients?
So unfortunately, hypopigmentation is much more difficult to treat than hyperpigmentation. So some of it also depends on the cause, but we have a lot more options to lighten pigment once it's there versus bring pigment back once it's been lost. And so some of the things that can cause hypopigmentation include sun exposure. Also, once inflammatory skin conditions, for example, like acne and eczema have healed, they can leave patches of hypopigmentation, so too little pigment. And then there are some skin diseases, for example, vitiligo, which can cause areas of hypopigmentation.
And what about blue light? There's been quite a few studies being bandied around at the moment that say that blue light increases hyper and hypopigmentation. What's the bottom line on that?
Yeah, I think it's a little controversial still. I think overall, for people that are very sensitive to either hyper or hypopigment, exposure to even ambient light like blue light can worsen pigmentation.
And just to explain, blue light is the glare that you get from computer screens, your iPhone.
Yes, exactly. And so I think for those it may be worth taking that extra step, wearing this protection indoors, maybe using a cover for the screen.
So vitamin C is like an age-old ingredient. I feel like it's been around for decades. Why is there still so much hype around it, especially concerning corrective skincare?
It is actually really a great skincare ingredient.
So it's not just marketing?
Yes, so it has a whole host of beneficial roles in the skin.
And what does it do for pigmentation? Tell me how it works.
Yeah, so it works to fade pigmentation, and part of that is because vitamin C is an antioxidant. So you hear a lot about antioxidants, but basically what they do is it helps to neutralize free radicals in the skin. So these are little chemicals that damage skin and are produced by skin metabolism and also by exposure to things like UV light and environmental aggressors such as pollution.
We've talked about vitamin C, we've talked about retinol. Niacinamide.
Yep.
Tell me about that.
So niacinamide is a great, very versatile skincare ingredient. Essentially, it's an activated water-soluble form of vitamin B3, and it does a little bit of everything. So it increases cell turnover, it acts as an antioxidant, similar to vitamin C. It also boosts the microcirculation in the skin, so the blood flow in the skin, as well as hydrates. So it's suitable for those even with sensitive skin types.
And it's available on the high street as opposed to just with a dermatologist?
It is, exactly.
So maybe let's now just touch on the big elephant ingredient in the room, hydroquinone. What do you think about it? Is it true that it's really as evil as it's made out to be?
So you're right, it does get a very bad rap. And really, hydroquinone is a very effective treatment for hyperpigmentation, so too much pigmentation. And the way that it works is by reducing the production of melanin, so the pigment in our skin, and also accelerating the breakdown of melanin.
And it does that topically or orally?
So it's topical.
Okay.
And I think part of the confusion is that, first of all, it's not a bleaching cream. So it doesn't actually bleach skin, but what it does is reduce pigmentation. Why it has such a bad reputation is that some of the older formulations, probably because of the way they were made up, as well as additional ingredients, did actually cause hyperpigmentation when used for extended periods of time.
That's terrible.
But in the newer formulations, we really don't see that. And I generally recommend that patients, in my office, use it, but under the care of a healthcare professional.
Because it is actually banned on the high street in the UK, correct? Not in the US, but in the UK?
So for now, it needs to be obtained only through prescription. And I think that's a good idea, just because you are going to limit sort of where it's being used, for how long it's going to be used.
I read that if you have pigmentation, be that acne scarring, hyperpigmentation, light spots, dark spots, I read that once you get it, it never goes away, no matter how much you treat it. Is that true?
So luckily that is not always the case, which is good. I think those who are predisposed to developing sunspots, once you fade them with skincare or in-office treatments, they will improve. The problem is that that person is then predisposed, most likely from genetics, to developing pigmentation.
So that's in your DNA. Nothing you can do about that.
Yes. However, things like inflammatory skin conditions such as acne and eczema, if those leave areas of pigmentation which are corrected, those should not recur. So that's good news.
So some good news. Brilliant.
Yes. And then melasma, which is a very common form of pigmentation, especially in women, tends to be somewhat hormonal. That unfortunately does have a tendency to recur. So people who are prone to melasma really need to be quite judicious in their sun protection. And I think one other thing that's really important to note about melasma is that it's really important as well to see someone, if you are going to go outside just skincare, in terms of seeing an esthetician or healthcare professional who has a lot of experience with melasma, because there are therapies out there that can actually worsen it.
And melasma, you said, was hormonal, so you might get that from changing the pill, you might get that from pregnancy.
That's exactly right.
Is it true that if you get melasma, you're going to have a girl?
Unfortunately, there is no truth to that. No correlation.
Good, well, we know now.
Yes.